In this morning's Health Watch, new information on diabetes treatments. A landmark federal study on aggressive treatments for the most common form of diabetes released over the weekend. And our Dr. Jennifer Aston is here with details on the study. This was a big study, went over a long time with a lot of people. What were they trying to figure out?
Well, first, let's do a little review of Diabetes 101, if you will, because there are different types of diabetes. And this study looked particularly for patients with type 2 diabetes. Type 2 diabetes, also known as adult onset. Exactly. Right. Typically or commonly, it can be associated with obesity and estimated to affect 25 million Americans, Harry. So this is significant because we know in the medical field that the leading cause of death among patients with diabetes comes as a result of what we call microvascular or macrovascular complications, i.e. leading to heart attacks or strokes. So you're talking about a big group of people with a very common cause of death.
So this study that has been going on, it's a very big study, and there's a lot of sort of anticipation about it. What did they find out?
Well, first of all, as you said, it appears in the premier medical journal, comes out of a reputable source. They looked at about 9,300 patients, followed them for an average of 6.5 years, some much longer. And we should say this study was sponsored by one of the drug makers of the medications that they were testing. They divided this 9,300 patient group into two groups, those who were at risk for developing type 2 diabetes and got a placebo or sugar pill, and those who got a medication that increases the amount of insulin produced by the pancreas. They found, Harry, after looking at them for years, there was no statistically significant difference in those who progressed to type 2 diabetes or those who suffered heart attack, stroke, or death. In fact, they found the drugs were only effective in about 15% of patients with type 2 diabetes.
Isn't that something? Wow. There was so much anticipation about this too then. So what's the extrapolation? What do we take away from this?
Well, the subtle and intricate point here, and as I said, it was a sophisticated study, was based on the fact that patients with type 2 diabetes, because they typically are obese, they have high cholesterol, high blood pressure, the metabolic syndrome. If you could target each of those individual risk factors in addition to their sugar control,
and help bring that all down.
You got it. Then you would have an impact on their incidence of stroke, heart attack, and death. This is possibly an example, Harry, of about how more is not always better when you're talking about medications.
And in this case, it turns out, it looks like all those old things that we have been saying for years and years and years about diabetes is what you really, if you really want to back away from the symptoms, you've got to, among other things, back away from the table.
There's no question that it is much preferable to prevent a disease in the first place than to treat it once it has appeared. But people with type 2 diabetes, if they think they're on one of these medications, it's the brand name Starlix, for example, do not discontinue without speaking to your doctor, of course. And we need to really look at this like the glass is half full. As these drugs are more and more on the market, they will be studied more rigorously, not just whether they work in the lab, but whether they prevent the endpoint that's relevant in a clinical sense.
And in the end, it's also, though, the better you take care of yourself, and especially these situations, you can make those symptoms, in some cases, even disappear.
The patients who lost weight had a reduction in their risk factor.
Dr. Jennifer Ashton, always.
You bet, Harry.
Thank you very much.